Okay, we're going to start with the pectoral girdle, which includes the clavicle, the sternum, and the scapula. The clavicle attaches to the sternum at the sternal end and attaches to the scapula at the acromion, the acromioclavicular joint, the sternoclavicular joint. The scapula, this is the acromion, which comes off of the spine, the supraspinous fossa, the infraspinous fossa, goes into the glenoid cavity, which comes out with the coracoid process. The glenoid cavity is where the head of the humerus fits. On the anterior of the scapula is the subscapular fossa. The humerus, the head of the humerus fits into the acromion, the glenoid cavity of the scapula, with the lesser tubercular and the greater tubercle, and then the deltoid tuberosity is the notch on the lateral side of the humerus. The coronoid fossa is the anterior depression at the distal end of the humerus, and the olecranon fossa is the depression on the posterior end of the humerus. And those allow for the corresponding process of the ulna to move freely when the elbow is flexed and extended. The lateral epicondyle, the medial epicondyle, the trochlea attaches to the ulna and the capitulum. The capitulum is right there. So moving down to the lower arm, the ulna attaches to the trochlea. With the olecranon process, the olecranon. The coronoid process is the bony prominence at the proximal end of the ulna, the head of the radius, and the radial tuberosity is the medial ejection. Going down towards the wrist, the radial styloid process and the ulnar styloid process, which you can see much better from the posterior view. The radial styloid process and the ulnar styloid process. On the carpus, go from the scaphoid, lunate, tricuspal, and the pisiform, which sticks out quite a bit. The trapezium, trapezoid, capitate, and hamate. The radius joins at the lunate and the scaphozoid, and the ulna attaches to the radius. The pallex attaches to the trapezium to form the thumb joint. The metacarpals are the first bones of the fingers, and the phalanges are the tips. Moving on to the pelvic girdle. It's made up of the coxal bones, which is the ilium, the pubis, and the ischium. And they would have fused in development right about here down to the pubic symphysis, and the ischium would have been fused right about here. This is the orbitor foramen. The iliac crest and the iliac fossa, or I'm sorry, the anterior superior iliac spine. The iliac fossa is the large flat area of the iliac, of the ilium. The aceптulum is where the head of the humerus fits. And the greater sciatic notch is up in above the, the greater sciatic notch is right there. The ischial spine is right there. And the ischial tuberosity is right back there. The humerus, or I'm sorry, the femur. The head of the femur fits into the acetabulum, and begins with the greater trochanter, notch right there, the lesser trochanter there. Moving down, you have the lateral condyle, medial condyle, you have the lateral epicondyle, medial epicondyle, and posteriorly you have the medial epicondyle and lateral epicondyle. And then medially you have the adductor tubercular, which is right there. And then the floating bone, the patella. Moving down into the lower legs, you have the tibia and the fibula. The tibia is the larger of the bones. You have the tibial tuberosity, which is the bony prominence, proximal. You have the medial condyle. And you have the medial malleolus, the lateral malleolus of the fibula. You have the inferior tibiofibular joint or distal tibiofibular joint, and you have the superior tibiofibular joint or proximal tibiofibular joint. On the fibula, here's the head of the fibula. The tarsus begin with the talus, which connects to the tibia and the fibula. The calcaneus, which is your heel bone, which comes down to the cuboid. The navicular attaches to the talus, and then you have the medial, inferior, intermediate, and lateral cuneiform bones. You have the metatarsus and the phalanges, and the great toe is the hallux.